Good afternoon, everyone. We're going to get started in just a minute as people start to filter into the room. Be excited for day one of policy. Give us just a few minutes and we'll be ready to go. Okay, good afternoon, everyone. My name is Dr. Nastasia Davis. I am the founder and executive director of the Perinatal Health Equity Initiative. It is my great pleasure to bring you day one of our policy series. It is my pleasure to introduce Senator Ruiz. She became the first Puerto Rican elected to the Senate when she was elected in 2007. Since then, she has been reelected 3 times. Senate President pro tempore Senator Ruiz is the first Latina to serve in leadership and is also the chair of the Senate Education Committee. Throughout her time in the Senate, she has fought for equity in educational spaces, acting as the leading force in expanding access to early childhood education throughout the state. She also spearheaded the law to build on the federal free and reduced meal program so that all children who qualify for the program could receive breakfast and lunch at no cost, eliminating the reduced category. Furthermore, she has sponsored laws to increase diversity within the school curriculum and strengthen Amistad Commission. The senator has also focused on expanding employment opportunities for underserved communities, sponsoring bill packages to expand apprenticeship programs in the state and increase teacher diversity. The apprenticeship package, which was enacted, created more accessible pathways to careers in high growth industries by incentivizing business participation in apprenticeship programs. In addition, she has taken a targeted approach to mitigate the barriers which prevent people of color from obtaining and retaining full-time teaching positions, advancing legislation to establish educator apprenticeship programs, providing load reduction opportunities, and expanding alternate route programs. Senator Ruiz was also the prime sponsor of the 2020 law to allow candidates to use campaign funds to cover child care expenses incurred due to campaign activities. The senator received a bachelor's degree from Drew University. She was also a 2010 Aspen Institute Rhodo Fellow and a graduate of the Harvard Kennedy School's Seniors Executives in State and Local Government Programs. She is vice chair of the Essex County Democratic Party and is deputy chief to the staff to Essex County Executive Joseph D. Vincenzo Jr. She served as a delegate to the Democratic National Conventions in 2004, 2008, 2012, and 2016. Among all of her accomplishments, the title she holds most dear is that of mother. It is my great pleasure to introduce Senator Teresa Ruiz.
Good morning, everyone, and thank you, Doc, for inviting me to this space, and for all of you for lending your ears, your love, and your passion. The bio was a little outdated, and I want to lift this up just to say that most recently, I became the highest ranking Latina ever in the state of New Jersey as a Senate Majority Leader, and the reason why I want to lift that up, and it's important because I was the first woman while elected to give birth in office, which speaks volumes about the people who are representing us in different spaces and why the need for us to be in the rooms when the doors are closed instead of outside when policy is being dictated and made. I want to thank everyone who is working in these spaces. As a mother of a 5-year-old, one who relied on a doula when I was inside of my labor process, one who had access to private insurance, one who understood the language, one who had a network, and one who had a partner. And I still had issues in all of those spaces. The level of newness doesn't matter what kind of degree you have, education, support systems. It is such an overwhelming time for that human being to be experiencing everything that's happening to you, that the more we can create these bridges and these networks to just really lift up that individual, to support that person, and to answer any questions that we may have in those spaces is something that I will lean into at any point in time and lend myself to legislative policy. I was very fortunate to have all those components, and yet I still had circumstances where I had questions that were unanswered. I labored for that long because my Pitocin drip, I was induced, my Pitocin drip was not coming down at the rate that it should. And so perhaps a whole process that should have taken 3 or 4 hours really went into a 24-hour extended time frame. That because I was a geriatric pregnancy, because I was above the age of 35 and above the age of 40, that I knew that there was a moment in time there where the decision was going to be made whether to have a C-section or to have a vaginal birth, because, you know, the priority is health. But all these things kind of impact all of us. Now, compound that when not understanding the language, and compound it when you look a specific way, and then you realize why the numbers in the state of New Jersey are as they are. Mm-hmm. You know, New Jersey has a lot of things to be proud of, but ranking 47th for maternal and infant mortality rates in the country is one that we have to move away from dramatically. It is an honor to have worked with colleagues in the legislature and with many of you who work in these spaces to elevate the importance of having access to doulas, which we did during, we included in the Medicaid program, which came out of an administrative effort supported by the First Lady. I was very proud to have the governor sign a bill which will, in the future, outside of the nurse home visit program that we have in the state, that every single person who brings home an infant will have at least one, if not up to 3 visits from a medical professional. And that, I will tell you, will change the trajectory of that human being in those first days. When I brought her home, we are so laser focused on taking care of that human being that you grew for 9 months. You knew what you were doing to some degree when they were inside of your belly. And yet, when they come out, it's this just, you give of yourself so much, you know this, that you lose yourself in that entire space. I was committed to nursing her for at least a year. And because Obama had included all these things that were to be covered on the federal level for insurance practices, I was fortunate to have a nurse lactation specialist come to the house, because I was caught up in this space of, am I feeding her enough? Am I producing enough? Why is she nursing every hour and a half, which is totally normal? All these kind of things, and second guessing what I was doing. And when that nurse came into my house and stripped her and weighed her before and asked me to nurse her and weighed her and said, you just gave her 2 ounces. And you all know that in the beginning, if you can produce 2 ounces, that's an extraordinary thing. It changed the relationship between my daughter and myself when it came to feeding her, which is an amazing thing. And I was able to take her on that nursing journey for 4 years. Wow. Until she decided that she wasn't going to nurse anymore. And so, understanding that lens, I drafted that bill, solely still thinking about the care of the child. And it wasn't until the day that the bill was signed that a mother sitting to the left of me, she had a toddler and she had just brought home an infant, and she was part of the nurse visitation program. And she said, if the nurse had not come to my house and taken my blood pressure, I would not have been here today to witness this bill signing, because her numbers were just off the charts. And it clicked in my head that while I had drafted this through the lens of the infant and the child, that forever in perpetuity, the state of New Jersey will have bills and protections in place that will save lives, not only for the children, but for the women who are in these spaces that we lose so much sight of. So I'm super proud of that when and if, in fact, my daughter decides to give birth and she lives in the state, she's going to have that extra level and that extra lens. And so I'm really proud of the work that New Jersey has done. And it doesn't mean that we have to lean in more and do much greater things. We have to be sure that there's equity in all these spaces. We've introduced bills and have bills signed to be sure that the way we teach the next generation of medical leaders, the way people in the health industry perceive who we are and what we look like, that our voices are clearly being heard. And that's a process that's going to take some time, but with the work of everyone on this journey, I think we're going to make inroads and steps. It's very fortunate that you have had a legislator that has worked in the weeds for this, and that then got coupled with an administration, the efforts of the First Lady, who has elevated this really on a statewide and a national level, and has brought resources to the fold to make sure that not only are these just bills that sit and linger, or regulations that hospitals are told that they have to follow and medical practitioners need to do, but that it actually becomes tangible ways that we nurture and provide for the woman and for the child in these spaces. And so I know you have a lengthy agenda, but I just want to say I'm grateful for all of the work. I'm grateful for the doula who stood by me and sneaked me pieces of I know I wasn't supposed to be eating at the time, but I was hungry after 30 hours.
No more of labor. You can absolutely eat in labor.
You see, that's exactly it. And she kept saying to me, it's okay, it's okay. And I was like, then give it to me, because I was starving. And the other thing, I want to say something to everyone who is on here, because this is something that I learned, and this is why I was induced, that I learned during my pregnancy. I don't remember what trimester I was in, but my feet were itchy. And I remember having access to my OBGYN. We a phenomenal relationship, so I had her cell phone. And because I was, how we all are in that space, I actually questioned her, and she checked in on me, and I said to her, my feet are itchy. She said, go right away to the lab. I want your blood drawn. And of course, you have that moment of panic. And she said, sometimes that's an indication of a liver enzyme that gets elevated during pregnancy that could lead to stillbirth.
Yep.
In my lifetime, and this is not something that gets discussed everywhere, had never been told that. And so again, right before Silver was due October 12th, and I was induced on the 25th, it was because, again, I was feeling that sensation, and I knew that I had to go. Unfortunately, that blood work exam takes over 24 hours to see. And because she was ready and I was ready and everything was kind of in place, we decided to let's welcome her in earlier to be sure that there isn't something that could change it. But for anyone who's out there, trust your instinct. If there is anything that you feel that doesn't feel right, reach out to someone who can help answer your questions. Because something as simple as I thought I was just big, it was the hottest summer of in that century, of course, it would have been while I was giving birth, that I asked the questions. Even though if we're not heard, even though if we get told everything is okay, keep asking until you have 100% been solidified that you are okay and that they are okay.
Well, I want to thank you for your leadership and all that you have done to change the landscape of maternal health in New Jersey. And as a nurse, I want to personally thank you for uplifting the role of nurses in this disparity. I think we're kind of left out of the conversation often. And I think our role is incredibly important, just as everyone else's. And so I thank you for putting us at the forefront. And as a lactation consultant, I see that you always keep breastfeeding in the forefront of things as well, which is often left out of things related to maternal child health. So I thank you for those things as well.
Thank you.
All right. Thank you so much. Have a wonderful day. So thank you for that wonderful presentation. We are waiting on Angela McKnight, Assemblywoman McKnight. I believe she should be able to join us shortly. In the interim, I am going to get started with our next presentation from Lexi White, and I'm going to begin reading her bio. So, Lexi White identifies as she, they. She is an award-winning reproductive justice advocate, policy strategist, and movement builder who is passionate about intersectional movement building and policy change. Lexi has worked for 8+ years to disrupt power dynamics and marginalize Black leaders in the reproductive and wider feminist movement. Lexi is currently the Director of State Policy and Advocacy at In Our Own Voice, National Black Women's Reproductive Justice Agenda, where she focuses on state strategies in addition to capacity building, power shifting, technical assistance, and organizational and leadership development to support state reproductive justice partners. Lexi has worked with New Voices for Reproductive Justice, the Philadelphia Commission for Women as a mayoral appointee, Babishi transitioned to Hope, Grassroots Campaigns Philadelphia, and the Penn Women's Center. Lexi holds an MPP in Public Policy from Temple University and a dual Bachelor's of Arts degree in Political Science and Gender, Sexuality, and Women's Studies from the University of Pennsylvania. Welcome, Lexi. Thank you so much for giving us this amazing presentation. I know I'm personally looking forward to learning, and I'm going to give you the floor.
Thank you so much. I'm very honored to be here. I'm going to go ahead and share my screen. Give me one moment. All right. Awesome. All right. So this presentation entitled Policy and Legislative Advocacy 101 is intended to really be a 101 level introduction into legislative advocacy. So I'm going to cover some of the nuts and bolts of policy and advocacy at a beginner level. And hopefully time will allow for me to get into the second part of the presentation, which will also talk about our national Black RJ policy agenda that we are working with partners in the states around to build power. And I'll also talk about some of the federal Black maternal health policies that we are currently working to advance with Congress. So first and foremost, I want to talk about some of the things we visit legislators to do. And I know, we use the term visiting differently in these times because before the pandemic, we were meeting so much more frequently in person with our legislators. But, obviously in this new virtual realm, we are doing a lot of this legislative advocacy in a different and evolved way, which is wonderful. But we visit legislators to educate leaders, policymakers, and administrators who implement policies. We visit them to influence their voting power around altering existing laws, policies, and budgets. We advocate to develop new programs and to also create a more open and ongoing policy dialogue with decision makers that is responsive to the issues that are impacting our communities. Of course, as Black women, as Black, queer, and trans people, we are the experts of our own experiences, and we meet with our legislators to convey the experiences that we want them to center and address through policy change. What is advocacy? I know this word gets used a lot in different contexts. Advocacy is essentially a catch-all word for the set of strategies used to create a shift in public opinion and to mobilize resources to support an issue, a policy issue, and as Black women, an entire constituency. Advocacy is telling a story about the change you want to see in the world, and it helps organizations build a base of support to raise the visibility of their own work, mission, issue priorities as an organization, but to also educate the public and their base of support around this issue or cause. There's a lot of expertise here, and I know in our audience, but just for some groundwork setting, reproductive justice indeed was born out of a frustration around the global reproductive health and wellness status of Black women, the limitations of a pro-choice movement that marginalized Black women and gender expansive people. And as a grassroots and human rights movement, we are centering intersectional strategies to address bodily autonomy, freedom, and reproductive decision-making. We approach these issues at the intersections of race, gender, class, sexual orientation, and gender identity. Of course, considering the intersectional impacts of our economic well-being, our political representation, and a culture that impacts our lived experiences. Reproductive justice organizations across the country are currently continuing to lay the foundation for policy change that impacts the lives and well-being of Black women, femmes, girls, and gender expansive people at all levels, local, state, and congressional. There's several forms of advocacy. Legislative advocacy is just one type. Legislative advocacy or policy advocacy, I'll say those terms interchangeably, But other forms of advocacy include citizen advocacy, informal advocacy, media advocacy, peer advocacy, which could be, peer-to-peer resource counseling or support, and self-advocacy, which is so important. As Black women, when we think about advocating for ourselves, as we navigate the healthcare system, as we navigate our birth and parenting journeys, being our own best advocate, and using a lot of the same skills that we use in working with policymakers to advocate on behalf of our own lived experiences in our daily lives. Now, what is lobbying distinctly? Lobbying is asking a decision maker to do something, change something, or stop something using their office. It can be direct or indirect. I'll talk about the differences shortly. And each state has different rules about lobbying. So as an advocate, it's really important to know the rules of your state, as well as the lobbying constraints of potentially of your own organization, depending on your own tax status, et cetera. But direct lobbying versus grassroots lobbying. Direct lobbying is communication with a legislator that expresses a view about specific legislation. And grassroots lobbying is communicating more broadly with the public, expressing a view about specific legislation, often including a call to action to contact a legislator at any level of government to take action on this policy. Educating, advocating, and lobbying, these terms are sometimes used interchangeably, but there are some differences between the two, and I just wanted to take some time to between the three, I just wanted to take some time to point those out. Education on an issue, on a policy issue, often is presenting basic information, such as a program description, goals, current budget, number of people served by a program, its accomplishments and impacts. Usually educating alone does not make a clear value judgment or specifically name a legislative action. Advocating kind of goes a step further, conveying a value in a general sense. An example here is clean air is good and we should protect the environment. It makes a value judgment but does not seek specific legislative action. And then lobbying occurs as soon as you make an ask for Congress, again, state representatives as well, city council representatives as well, to take action to increase a budget, to support or oppose a bill, amendment, a regulation, or a policy. I'm not going to play the video in the interest of time, but we have a great video from a recent, well, I guess this is already pre-pandemic, but the last time our organization was in massive numbers on Capitol Hill for a lobby day in partnership with National Asian American Women's Forum and National Latina Institute for Reproductive Justice. We brought lots of advocates to DC for a lobby day where we talked about a range of reproductive justice policies and really centered our own lived experiences. You can access this video to learn more at intersectionsofourlives.org. In preparing to meet with legislators, whether in person or virtually, there's some really certain best practices that I always share with advocates. It's important to identify the roles for the meeting, make sure that you plan who will speak on each issue, identify a facilitator for the meeting who can help frame the issues at hand, and to make sure that issues and key talking points are covered in that time. You might have a limited time window with the elected leader you're meeting with. Know what you really want from the meeting, map out what your intended outcomes are, and make sure you get to the ask. Make sure you land the plane, as we say, and really prioritize your key ask, whether that's to sign on to a letter, to introduce a resolution or a bill, to work on introducing a new program. This should be one of the first things you do after introducing yourself in the meeting or introducing your entire delegation. And know your target. Be sure to know the affiliation, committee or subcommittees, membership of the legislator you're meeting with. Know a little bit about their voting history, maybe their own personal stories that they've shared to help build that rapport and connection and to see where you can find common ground. Bring written materials, fact sheets, testimonies, etc. are always helpful. Again, do your homework, be prepared, anticipate questions or arguments for or against the position that your delegation takes in a legislative advocacy meeting. Some of this has changed again in the virtual realm, but we always suggest that folks wear professional attire, or if you're going as a group and you're wearing more informal attire, it can be helpful to be uniform to really show the power of your delegation. Again, assign a facilitator, make it personal, know and believe that your own experience is expertise, and offer solutions about what is working in addition to what can be done better. Tell your story, be succinct and to the point, but don't be afraid to tell your own personal story, which can really, really be powerful to change hearts and minds about an issue of importance to your delegation. Again, connect with the staffer, read body language in the room to assess where a staffer or an elected leader may land on an issue. Go with the flow and make sure you follow up. This is so important. Make sure you follow up. Send a thank you. Send over the materials that you came in the meeting with, or that you maybe want to still refer them to. Send an example of a bill in another state that maybe does and achieves what you'd like to see done in your state, and keep those lines of communication open with your elected leaders. We always say there are 5 key parts to a successful policy meeting. Introduce yourself, cover the issue, share a story from yourself or someone in the group who can really help to personalize the issue. Get to your ask, and make sure you have a concise closing that summarizes why you were there and your key ask. Be on time, be flexible. Again, we're all trying to be so much more flexible in this virtual realm, and sometimes that means potentially more access to legislative staff of your elected leaders in the virtual realm, but it also sometimes means shorter meetings, as virtual meetings are potentially more high in demand, and we are seeing that more, both on the Hill and with state legislators. Make sure your legislators know if you are a voting constituent in their district. Make sure they know that you vote, and make sure that they know you're paying attention. I'm going to move ahead a little bit. This is a little bit deeper on sharing your story, bringing an issue of importance to life. A story can provide supporting evidence to the issue and help drive the ask. Again, a story should strongly support the ask. It should highlight a hurdle or injustice that we want to see change. It should be compelling, clear, and understandable. When you're making the ask, make it clear and actionable, and then wait a moment, wait for a response. Allow your elected leader to share more about their position, and that will give you a little bit more perspective on where some follow-up questions might be suitable, where some follow-up data or statistics or talking points might be helpful. So let them give you something to respond to. Even if they first voice disagreement, you can sometimes counter that in listening further about, to their response with some good talking points. And again, as you conclude your meetings, address any questions they may have. If you don't know the answer to a question an elected leader has for you, you can always follow up. You can always cultivate that relationship with them and their staff, their legislative directors and assistants, et cetera. Thank them for their time. It can be helpful to take a picture, especially in the virtual realm. You can help amplify their position on a bill or an issue by taking a picture and tagging them on social media. And they appreciate often the support when you are helping to amplify their work and working together to get an issue, to get a bill achieved, and to raise issue awareness around issues that are on their agenda. Again, make sure you follow up, tailor the email that you send and follow up to include state-specific information, which I think is always so important, even on these big issues that are of national importance. Bring in some state and local data, and invite them to your next event. Invite them to visit you next time they're around or in their district, and keep that relationship going. I'm going to shift gears a little bit. This is part 2 of my presentation. I'm trying to kind of get a lot in this hour because there's so much we can cover, but I want to talk a little bit about the Black RJ policy agenda. So in our own voice, National Black Women's Reproductive Justice Agenda, who I'm representing today, is a national and state partnership currently of 8 Black women-led strategic partner organizations across the country, and we are expanding partnerships in the states currently that centers the voices and lived experiences of Black women, specifically in the ongoing policy fight to secure reproductive justice for all. We launched a policy agenda in June of 2021 in partnership with our co-conveners and all of our strategic partners and other experts at even non-partner organizations. We still convened for this project, but it was us in collaboration with Interfaith Voices for Reproductive Justice and Sister Love to propose a wide breadth of policy solutions to address social, economic, political, and health needs of Black women, femmes, girls, and gender expansive people. Again, centering a human rights reproductive justice framework and Black feminist theory, and centering the impacts of race and gender and multiple forms of oppression on our lives. We know that the COVID-19 pandemic alongside lots of reignited civil unrest as a result of police violence and brutality, all of this together has reminded us of significant health disparities and ongoing oppression that we face. It has also called us to be organized and to mobilize collectively with clear policy solutions. So more than 30 Black RJ organizations and activists came together to contribute to this agenda across multiple issue areas. And we have 3 kind of core sections to the agenda that cover a number of different topics. The first is sexual and reproductive health. The second is social justice, community justice, and safety. And the third is religion and reproductive justice, where we had some awesome thought leaders who are really experts in centering faith experiences and advocating for reproductive justice as well. Policy recommendations are baseline for Congress and state legislators. While many of the recommendations are congressional solutions, they are indeed ideas that can be adopted in the states, and that really state legislators are better equipped to take faster action on to advance reproductive justice and specifically maternal health equity for Black women in their states. Just want to share a little bit about some of what we're also learning about Black women voters in this time of, in this turbulent times, I will say, coming out of a very harmful administration and then directly into a pandemic. Black women respondents from our Intersections of Our Lives poll in 2021. This was a poll that polled Black women, Latinx women, and AAPI women across the country. Black women specifically reported that their mental health had really suffered, that they had higher rates of having directly experienced a family member loss to COVID-19, and also having directly had economic struggles as a result of COVID-19 that may have resulted in missing a bill payment or having trouble making ends meet in terms of their day-to-day bills. And so, financial assistance, including rent assistance, employment benefits, food and nutrition support was especially high for Black women respondents in the survey, as well as a call to action for Congress to take action to raise the minimum wage, among a long list of intersectional priorities, which we all know contributes to our overall health and well-being and our ability to raise healthy families and experience optimal maternal health outcomes, maternal and child health outcomes. 66% of respondents agreed that pregnant people should also be able to access abortion in all or most cases. 90% wanted elected officials to know how white supremacy impacts their lives. And the most important issues that Black women reported in the survey that they wanted to see Congress take action on were to end discrimination based on race, ethnicity, or immigration status, to reform a criminal justice system to operate fairly and equitably, to ensure that people living with pre-existing conditions can still get health insurance, to reform policies to address and prevent police violence, specifically against Black people, and to stop making it harder for certain groups to vote. This is a midterm election year, and we are already seeing lots of efforts at voter suppression in the states. And so, Black women respondents specifically named this as a priority for them. Ensuring access to clean water. This ranked number 6 in this survey, but it has ranked higher up in recent surveys. There was another national poll we did on Black women voters that showed 1 in 3 respondents had voiced having seen either brown water or foul smelling water coming out of their tap waters at home, and also made the connection between lack of access to clean water and decision-making about pregnancy and parenting. And so this is, again, a key intersection as we think about advocating for policies that impact maternal health outcomes, ensuring that all of us have access to clean water in our homes, and that our families and children do as well. I'm going to share a little bit more data from a national survey. This was launched in 2021 on the lives and voices of Black families, where and again, this is just an abridged summary. There's so much in this report, but there was a lot of intersections considered by Black women respondents, specifically, again, in their decision-making around pregnancy and parenting, their decision-making and their partner's decision-making around having children. 65% of respondents, for example, noted having job opportunities that paid a livable wage was a key factor in that decision-making. Again, being safe from police violence and having money in your savings. Other issues show up here, higher than 50%, addressing systemic racism, affordable housing, having access to quality, affordable healthcare and education, having access to quality public schools, and equal opportunities to advance in the workplace. A few more issues, and I won't go through them all, but again, equal pay, addressing over-policing, healthy and affordable nutrition and food options and childcare, and for about 50% marital status. What I really liked about this poll was that it also focused on the experiences of younger Black women, so specifically women 18 to 44. Those experiences, the responses on these issues were way higher for younger women, which makes a lot of sense to me. But again, having job opportunities that pay a livable wage, the amount of money in your savings, and addressing systemic racism and police violence ranked even significantly higher for younger Black women respondents. Despite the number of health barriers that we face in these times, we are still optimistic about our perception of political power and our ability to make change, to advocate for change, and that includes advocating for policy change. 79% of Black women respondents agreed that Black communities have the power to lead our country to a more free and just society, and that we also have the power to, 76% said, we feel strongly that we have the power to change the outcomes of elections, which is very true, in my opinion. This is some of the issues covered in the sexual and reproductive health section, specifically of the policy agenda, which I wanted to highlight because this is where the maternal health chapter lives in the agenda. You can access the full agenda at blackrj.org, and as well as summaries of the different sections. But in the sexual and reproductive health section, we are talking about addressing adverse maternal health outcomes through policy change, maternal health care specifically for incarcerated Black people, alongside addressing contraceptive equity and reproductive health care, ensuring equitable access and coverage for abortion care, comprehensive and gender-affirming sexual health education, addressing chronic health conditions, reproductive cancers, mental health disparities for Black women and Black mothers, as well as assisted reproductive technology and genetic engineering. I'm going to skip just ahead in the interest of time. I, of course, want to talk a little bit about the Black Maternal Health Momnibus Act. Representative Congresswoman Lauren Underwood is a leading sponsor of this bill. I know there's a lot of expertise around this bill on this webinar, but it really is centering this idea of intersectionality, of addressing the social determinants of health on multiple fronts to achieve optimal maternal health outcomes for communities who are most impacted by the maternal health, the maternal mortality and morbidity crisis. It directs multi-agency efforts to improve maternal health, particularly, again, among underrepresented racial and ethnic groups, including veterans. Actually, the most recent successful piece of this package that passed and was signed into law was back in November of 2021. This was, hold on, pulling up the name of this bill. The Protecting Moms Who Serve Act, I believe it was called. And this is protecting veterans by improving conditions for women serving in the military to have optimal health outcomes during pregnancy and in the aftermath. This bill seeks to extend 24 months postpartum eligibility, the most recent version of this bill, for the SNAP program. It additionally directs HHS and other agencies to take actions to diversify the perinatal maternal health workforce, which we know is very important in delivery of culturally competent and affirming healthcare. This legislation issues a number of grants to different agencies to address perinatal care, Medicaid and CHIP program, and to support training technology and telehealth initiatives. It increases research and data collection on maternal morbidity and mortality, particularly among tribal groups and minority groups. It directs the Bureau of Prisons and the Department of Justice to establish programs to improve maternity care for incarcerated people. And in our agenda, you'll also see that we advocate for an eradication of shackling of any kind of prisoners who are pregnant, and that includes in transit and in labor and delivery. We also call upon healthcare professionals to disrupt that practice in any moment that they might be a witness to a pregnant person being shackled in labor and delivery and after. The bill also directs activities to mitigate maternal health outcomes that are associated with climate change, and to also improve vaccination rates in the face of COVID-19 amongst pregnant people. And we're currently fighting to include many of these provisions in the Momnibus bill to be included in the federal Build Back Better Act, which is essentially the congressional reconciliation package. We've been focusing on the mandatory year-long postpartum coverage for moms in every state piece of this package, but there's so much more that can be done as we negotiate congressional allocations for programs that support optimal maternal health outcomes. I'm going to share the list that the Federal Black Maternal Health Caucus is advocating for in terms of allocations in the Build Back Better Act, which we're hoping that Schumer will continue to take up this season. Some of these did not make it during last rounds of negotiations, but we are continuing to apply pressure with support from the Black Maternal Health Caucus and a number of other caucuses, including the Women's Democratic Caucus in Congress, and these would all have impacts for access in the states as well. So this package advocates for $175 million for local entities to address the social determinants of maternal health, specifically $75 million for community-based organizations who are working to address maternal health outcomes for marginalized communities. $275 million to grow and diversify the perinatal health workforce, and $50 million specifically for doulas. $100 million for maternal and mental health equity grant programs, centered grant programs, and $85 million to address the impacts of climate change related maternal and infant health risks, including, of course, exposure to extreme heat, which we are increasingly seeing research around the impacts of maternal health outcomes as a result of exposure to extreme heat in areas that lack green space, that lack shade, for workers who are working outside in hot temperatures. $50 million to advance maternal health research at institutions such as HBCUs that serve underrepresented communities. $50 million to promote representative community engagement in maternal mortality review committees across the country. $160 million to strengthen federal maternal health programs. $60 million to expand access to digital tools and technologies. $25 million to expand anti-bias trainings. I don't love that term. I'd rather call it anti-racist trainings, anti-racism trainings, but anti-bias trainings among healthcare professionals, and mandatory funds for expanded year-long postpartum Medicaid and CHIP coverage for moms in every state, which again is what we continue to push really hard for in the congressional space, and want to continue to support state advocates and advocating for this in their own states. And that concludes my presentation. Again, you can access this information in terms of the policy agenda itself at blackrj.org. And I'm happy to follow up with anyone individually with questions or resources at lexi@blackrj.org. That's my personal email address. So thank you so much for having me, and look forward to continuing to build with you.
Thank you so much, Lexi. That was an amazing presentation. Before we let Lexi go, I know this may be new content for some of you, so if there are questions, please put them into the chat. I will read them out to Lexi and she will have an opportunity to answer. I'm also going to drop her contact information into the chat so that you can reach out to her and her organization if you need any further assistance after today. All right, well, I have some questions while we're waiting to see if there are any questions that come in. If you are new to policy, what do you think should be like maybe the first step you do to kind of get your feet wet?
Yes, great question. So I think first and foremost, it's important to know, well, a few things. I think first and foremost, make sure you're registered to vote. And secondly, I would say know who your legislators are, know which district you are in locally, statewide, and congressionally, so that you know who represents you, and begin to think about what your elected leaders' positions are on issues that you care about. Do some research around how they voted. Do some research around the committees that they sit on, the topics that they're covering when they're giving public addresses, et cetera, the advocacy that they're doing. And you can also track a lot of legislation. There's different platforms to track legislation. A lot of state legislators make that information public, like when they're having hearings on certain bills. But if you are new to policy, but know you have an interest in a specific issue, Do your work to become as educated as possible about that issue, about who some of the other stakeholders are in your area who care about that issue. Maybe do some fact finding if you're representing a particular demographic or constituency. Do some fact finding around how that issue is, the impact, the research that's out there on the impact of that issue. And I really think it's important to just begin building a relationship with your legislators. I think it's important to demystify the policy-making process. It's often not as complicated as it seems. You don't have to be a legal expert all the time. You don't have to, not that we don't like legal experts, but you don't have to know the ins and outs of the entire process to be an informed citizen, to be an informed voter, and to be someone who can advocate and lobby for policy change. It really is, I always say, policy making is about people. It's about cultivating those relationships. So visit your legislators in their in-district office, reach out to them to schedule a meeting, to talk about the issues that you want to care about. Invite them to your community events. They are very, very busy, but they want to support you. They want to come out to your events. They want to do public education in their districts around the issues that you care about. So that's a good step for relationship building. Oftentimes, if you are organizing in your communities or you are connected to boards or organizations with a cause, invite your legislators and invite them to share their work and opinion around those issues. I think it's important to research what policies, what progressive policies you care about are happening in other states, because it can be a good template for legislators. It may not be a perfect bill, for example, but it may be a starting point, and you may be able to sit down with your legislator, with their legislative team or their legislative drafting support folks, to really sit down line by line and go through, read a bill and go through and it's not, they're not that, complicated always to read or to even draft yourself, but to really go line by line and see how can this be more expansive, who's left out of this language, who can we center in this language, to bring in more community voices around this to build a base of support. And again, I think it's really about keeping that relationship going. If you're wanting to introduce a bill and really build a coalition around that, it's going to be important to talk to other stakeholders and to see where there's room for collaboration. But I guess, yeah, my first step would be build those relationships where you are, where you live in your communities with your elected leaders.
Yeah, I have another question. Thank you for that answer. Now, we sometimes don't live in communities where we have people who are effective or are willing to listen. How do you suggest people go about working in those type of situations?
Yes, and that's such a great question. I'll add that one of the things I've learned a lot in doing this work, I grew up on the East Coast and have lived in cities where there have been still lots more action needed, but also cities that are, making a lot of noise around issues that they care about and doing a lot of disruption, right, to hold their elected leaders accountable. Sometimes that means exposing inaction, right, or exposing a bad vote.
You mean like through social media?
Through social media, yes, through social media, through other media strategies. It could be writing an op-ed, it could be writing a letter to the editor in a local paper, talking about an issue at length and wondering why action hasn't been taken on it. And that can also be used as a resource to kind of get to a conversation with someone who maybe is not taking action. And it oftentimes, like, strength in numbers, I think really helps, like, showing up in person. As Black folks, we are often, unfortunately, putting our bodies on the line more, I think, in my experience in this work, and we are also, more impacted when we are doing the call outs, if you will, the call outs and the call ins. But strength in numbers, I think, can help with that, and showing up with a big group to the state capitol, to a hearing, to a city council hearing, testifying in person, I think is really powerful. And that also brings some public awareness to the issue too, when you show up and testify in person. A lot of times there's also press at some of these local and state hearings, and they may pick up on the conversation that's happening and help to amplify it. So those are a few examples. But I will say, I started to think about, having grown up on the East Coast and started organizing. I was organizing a lot in Philly and in Pennsylvania, now working more closely as well with some Deep South partners, and just thinking about how culturally different it is in those legislators and how hostile it is around the issues that we talk about. And, sometimes you have to have different savvy tactics. I talked a little bit about like the faith lens, and we have some leaders who are like really great about that in this Deep South when you're navigating these elected leaders' offices who are like justifying everything through a religious lens. Folks who can respond unapologetically by bringing in their own faith experiences, but still holding true to reproductive justice values of access, bodily autonomy, and centering our human rights. So I think that's just like know your audience, I think is important, and know that the conversation might need to shift depending on who's in the room.
Thank you. So in New Jersey, if you are interested in following bills, I would definitely go on to the legislative website. You can actually sign up for emails to get notified when bills are up for discussion, so that if you want to appear, you'll be notified and you can put in that request to do so. So that's a website. I'll drop that in the chat that you definitely want to know if you want to be involved in policy. So my last question is, often when there's a bill coming out, I'll get a lot of emails from different organizations saying to email your senator or email this person, and it like makes an auto email to send to people. Do you find those things to be effective, or what do you think is kind of the best way to move things through? Like, are those, I always wonder, like when it says call your senator, like when you call them, what happens? Like, does anyone hear you? Are they listening?
They do. So a lot of these like platforms, and there's a number of different ones. Some of them, you do have to pay for some of like the auto populated ones, but they do send like your messages to your elected leaders. They do like sometimes auto call, like if you have a campaign running with an auto call feature, they will auto call. You might get a voicemail, but it will still demonstrate that like a number of people are calling on a specific topic.
Okay.
So I do think it's effective. And I know we see these action alerts on social media everywhere. I think it is effective. It's effective for reaching them, but it's also simultaneously effective for amplifying the conversation, which is ultimately what you want. And as you build your base of support, like if you are leading sort of a petition or a call to action, every person who fills that out, like you're hopefully now able to connect with them moving forward. So that helps to build your base of support to include folks on future actions moving forward. Awesome. So definitely do take the time and share the word with your networks.
Thank you. I'm not seeing any questions in the chat. I'm just going to double check. If anyone has any questions, this is our last call before we let Lexi go enjoy the rest of her Black Maternal Health Week. It's a very busy week for everyone. So I thank you for giving us your time. I know I learned a lot from your presentation. I provided the contact information in the chat box. So if you want to follow up later, I will drop in the legislative information as well. Lexi, thank you so much for your time.
Thank you. Thank you for having me. Take care.
You too. All right, everyone. So we are kind of in a 15-ish minute limbo. Assemblywoman McKnight will be joining us at 1:15. So if you want to kind of take a mini break, we'll be going into like our 15-minute break right after that. So if you want to take your break now, And then when the Assemblywoman is on, we will resume and then move into the second half of our day, which is focused on the new New Jersey Doula Collective and accepting Medicaid as a doula. So that'll be presented by staff from HealthConnect One. So we thank you for joining us for this presentation, and see you in a few minutes. Hello, Assemblywoman McKnight. We're going to get started back at 1:15. Our last speaker ended a little bit early. So I sent them on break, but everyone should be rejoining in just a few.
Okay, no problem. No problem at all.
Right, everyone, it is 11:15. I am happy to get started with our second half of the day. So we are fortunate to have Assemblywoman McKnight here with us. Do you want me to read the bio? So I couldn't find, I want to make sure I'm reading the right updated information. It's on LinkedIn. Is that still accurate for you?
We still have to do some updates, but go ahead and do your best.
Okay. Angela McKnight was born and raised in New Jersey. Working with people became one of her primary interests, along with caring for others. She is very friendly, dedicated, and a compassionate person. She reveals these great traits through her actions. Angela is the first African-American woman to become Assemblywoman for the 31st District in the state of New Jersey. She is a new author. Her first book is entitled Caregiver's Guide to Helping Seniors Eat Healthy. This book is a resource that not only helps seniors, but also empowers their caregivers. Purchase the book on Amazon or on her website, angelamcknight.com. Angela is the founder and CEO of the nonprofit organization Angela Cares, which is a 501c3 nonprofit organization headquartered in Jersey City. Our motto is a passion to care, the ability to help. Our mission is to serve as an advocate and support system for seniors, their caregivers, and a mentor to the youth by educating and empower them to volunteer. We are committed to strengthening communities by enhancing the quality of life through the generations. First ACI chapter is located in Las Vegas, Nevada, and that can be found on angelacares.com. I will link all of those things in the chat. Angela McKnight is a certified senior advisor, is the founder and president of the company Care About You. Our commitment to you is to be part of the village to help promote the well-being of seniors. Our services help guide clients through the decision-making process, helping caregivers, families, and professionals make the most knowledgeable, compassionate choices to put a care management plan in place. Angela, you may update anywhere where I have left things out. Feel free to brag on yourself. It is our pleasure to have you here, Assemblywoman, and I'm going to give you the floor.
you so much. You did a great job. You did a great job. Hello, everyone. Good afternoon. I am happy to be here with you on this beautiful day. It's literally nice outside. I know in Jersey City it's real nice outside. And I am honored to have a stage with so many beautiful women. So this week we are celebrating Maternal Health Week. Yes. And the week is mainly about awareness, togetherness, speaking up, taking actions, also learning and educating others. And this is what you all have been doing so far. I did listen on maybe about 45 minutes ago, the presenter who was on, and I saw some of the slides, and I appreciate what you have been doing. Now, as a legislator, I was elected in 2015. I took the oath in 2016, and I am now currently serving my 4th term. They're 2-year terms, and I am a deputy majority leader. I'm also the chair for Aging and Senior Services, vice chair for Women and Children, and I also sit on the Homeland Security and State Preparedness Committee. I was recently appointed and elected to chair the Black Caucus Legislative New Jersey Black Caucus Foundation, and I'm doing some other things. I sit on a plethora of boards, but let me tell you, one of the main things that are near and dear to my heart are seniors, but also the protection and the health of well-being of Black and Brown women. I have authored several pieces of legislation. Some are law, some I'm still fighting for, because we deserve the utmost respect and care in this world. As Black women, we are nurturers, we are carers, and we deserve to be cared for just as well as everyone else. So I'm also an instructor, and one of my entrepreneurs a couple of years ago, she was telling me about a doula. And I'm like, well, what is a doula? I had no idea what a doula was because I was not educated. And I have 2 children, and no one ever said anything to me about a doula. So I introduced a piece of legislation to appreciate doulas. And that's in March, as well as have an entire week of showing appreciation for doulas. And I said to myself, oh, I was my sister's doula when she had her child. I was in the delivery room with her. Her baby's father was just not feeling it. He didn't know what to do, but I was there coaching her and guiding her so that she can push my beautiful niece out. So I was there coaching her, and that is what a doula does. They're not only in a delivery room, but they're being pregnant and as well as post-care. So I introduced that piece of legislation, and it has passed, which I am so happy. I also introduced a piece of legislation, AR 53. I did it last session, and I had to reintroduce it to declare racism as a public health issue.
Thank you.
Predominantly for Black and Brown women in maternal health. We are number 47 with the 47 out of 50 states. New Jersey is 47. And I give praise to our First Lady, Tammy Murphy, and all the stakeholders who are helping her, including my colleagues, to make us, move down that chain, because we don't want to be 47. No. So I introduced that piece of legislation so that we can declare racism as a public health issue, so that more services and resources can come out of that. I also introduced with a couple of my colleagues AR 226, which is law, and that is to urge the officials at the Federal Centers for Disease Control and Prevention to adopt a uniform data collection system around maternal mortality. So that is up. We passed that, and we are still urging the Congress to make it happen. Because again, New Jersey is 47, but I know there are others who's 48, who's 49, right? Who's 50. Right. And there are Black and Brown women who live in each and every state in our country. So we need to make sure that we do what we need to do to support our Black and Brown women. I also introduced, 4935, that will prohibit the health benefit coverage of certain non-medical indicated early elective deliveries under the Medicaid program. Now, there are some doctors who are having scheduling because they want to go on, vacation, they're scheduling C-sections when the mom can actually go full term because they maybe want to, go away, get on their yacht and go away. So we have definitely put in a piece of legislation to prohibit that. C-sections should only come in the event of an emergency or if you really can't bear a child. So I introduced that. And I work with my Black caucus as well as my entire caucus to strengthen and put a light on the importance of caring for our Black and brown mothers. I mean, for all mothers, right? Everyone deserves, if you are childbearing, everyone deserves the utmost care because we are bringing in our future generations so that they can take care of all of us. Right. I know I want my children to take care of me and I want my great grandchildren to take care of them. So I'm here for any questions. And I just appreciate you for Dr. Davis, for putting on this beautiful program the entire week and uplifting the importance of maternal health. So I appreciate you and I thank you.
Thank you. And we thank you as well for your commitment to making New Jersey different. We have got to change that narrative. We can't keep holding 47th as some sort of badge of honor. We've been saying it for years now. So at some point, we've got to start moving the needle. So I hope that new legislation and working together will help to make an impact on these numbers. Does anyone have any questions for Assemblywoman McKnight while I have her here? I'm not seeing any questions in the chat, but I thank you so much for making time for us today and telling us what's going on in New Jersey. I believe strongly that we need to all know what's happening. We need to know what bills are out there. We need to know what they're for, and we need to be able to use our voices to make sure our concerns are being addressed. So I thank you for putting that at the forefront and all the amazing work that you've been doing. I hope you have an amazing rest of your Black Maternal Health Week. And I hope to connect with you again soon.
Absolutely. And I would like to leave one charge with everyone.
Yes.
If everyone can reach out to their state senator as well as their assembly people for AR 53 and ask them, do they support this? And that particular resolution is to declare racism as a public health issue. So reach out, use your voice, use your social media handlers, use the email and ask them, where do you stand with AR 53? That's the charge that I leave for you because collective, we can do it. So I appreciate everyone. Enjoy the rest of the week. And Dr. Davis, you may see me another day this week. Just send me those links, okay?
All right, will do. Thank you.
You're welcome. Take care.
All right, you too. Bye-bye. All right. So we are ready to move into our next session. We have two speakers here from HealthConnect One who are going to introduce you all to the New Jersey Doula Collective. First, I would like to introduce Sean Vey. She is an LPN certified full spectrum doula and HIV counselor. She has had 10 years of experience in nursing, as well as an extensive case management and community outreach experience. She is certified in client-centered counseling, risk reduction counseling, and currently serves as the Director of Project Management for HealthConnect One. Thank you and welcome, Sean Vey. And next, I would like to introduce Joni James. She holds a Bachelor's of Science in Public Health and is a trauma-informed certified birth and postpartum doula. She is a yoga teacher, PALE advocate, and certified lactation counselor. She has had more than 7 years of childcare experience and 3 years in the perinatal wellness field, focusing on empowered advocacy and reproductive justice. They currently serve as HealthConnect One's New Jersey's DLC project coordinators. I am going to give you both the floor. Thank you so much for giving us this wonderful presentation in advance. And I'm going to mute myself.
Thank you so much, Dr. Davis, and thank you for having us. We'll just briefly touch on the agenda. We'll do minimal introductions because she just did such a great job, just said everything I was going to say.
Absolutely.
The progress of, what really the NJDLC is. what progress have we made thus far, and also planning for the future. So we'll go ahead and just jump right in. My name is Shanbe Millian. I'm the Director of Project Management for HealthConnect One. I am currently leading for the New Jersey Doula Learner Collaborative. I will give you some background of how I came into the work. I so appreciated the Assemblywoman saying she was a doula and she didn't know she was a doula. And that's kind of really how I came into the work. You know, I've had family that were afraid to go into the delivery room because they felt unheard and unseen. And me being in nursing and, you know, they just thinking, you know, you understand more than I do, so I trust you. I would always get asked, can you come in? Can you come into the delivery room with me? I'm afraid. I don't want to do this on my own. And then postpartum work, I've been doing for years, but for us, for me, background coming from a Haitian Caribbean family, that's just family. So you go in and you make sure that you take care of the birthing person. You help them out, you cook dinner, you try to alleviate any stressors that they might have. You talk to them about different things that they do and talk to them about their concerns. So it's something that I had been doing for years. And then throughout my schooling and different things, I was like, oh, there's a name for this. I wonder, can I back charge some people? I don't know. That's pretty much how I got into the work. And you know everything else about me as far as background, so I'll kick it over to Joni to speak on her, I guess, background and how she came to be a doula.
Yes, thank you so much, Shanbe. And again, thank you, Dr. Davis, for such a wonderful and thorough introduction. It was quite beautiful. So I actually have two women that I think are pivotal and super incredible for me to even be in this role where I am today. The first woman is Dr. Amuda. She, at the time, she was a professor at Montclair State University, and she just inspired me to start this journey. She opened the line of thought for me about being an educated Black person in America. And as someone who is also Caribbean, I'm Jamaican, the idea is that if you come to America, you get a great education, you then should also increase your socioeconomic status. And that was not the case. So she opened the line of thought for me, okay, what about other people who are Black and disabled, or Black and they don't have quite the socioeconomic status to be able to improve their birth outcome? What about those people? And so that developed this passion in me to continue this work. And then also Jill Wadnick, her work as also my mentor when I was completing my thesis statement for junior year, and just going about reading about midwifery systems of care and how doulas should definitely be a part of that conversation. So that's how I got into this work. And here I am 3 years later as a full spectrum doula. I take pride in also accompanying my clients to be able to go throughout their birth process and journey, and I don't take it lightly. So thanks for listening.
All right.
So I'm sure everyone wants to know, what is the DLC? And I'm so happy to tell you. So the DLC is a collaboration and it just basically the brainchild of the Department of Health and the Office of the First Lady. As the Assemblywoman has said, we are 47th in terms of maternal health outcomes, and that is horrible. So how do we improve maternal and infant health outcomes? The DLC's main goal, just in summation, is to be able to reduce maternal and infant mortality, as well as eliminate racial disparities in health outcomes. How are we going to do this? We are going to provide training, workforce development, supervision, mentoring, technical assistance, direct billings aid for Medicaid, and then also creating sustainability. Most doulas in this work, we do burn out in 3 to 5 years. So as people who are needed to combat the maternal and infant mortality, how do we create longevity in this space? And then also just collaborating and connecting with community. We cannot do this work alone. So how do we include other people into this conversation and begin to do the work together?
So the main objectives of the Dual Learning Collaborative, we have 9 objectives, but they all pretty much fall under 4 categories. So that's the advisory board recruitment and implementation, training and clinical supervision, providing technical support, and leadership development and advocacy. So as we know, doulas became reimbursable through Medicaid in 2019, and that was a big win. Yay. And then it was like, well, how do we do it? So that really is what the DLC is for. So be able to form this advisory board that is centered around doulas, primarily. That will be made up mostly of doulas. Will be comprised of diverse membership with a large representation, at least 50%, well, 60% of doula voices, so that we really center doula voices in New Jersey as we progress with any new legislation or anything that's going to affect doulas and doula work in New Jersey. We also plan to establish a New Jersey specific doula curriculum. Technical support is given with Medicaid billing as well as Medicaid enrollment. Also conducting outreach and doula recruitment, establishing partnerships with health systems and healthcare providers, and developing, as Joni said, developing a plan for longevity, not only for the DLC to stand here, but also sustainable work pathways for doulas, because as she said, we know most doulas burn out within 3 years. So how do we create a space for doulas to be able to continue to participate in this work?
Mm-hmm. We want to be here for a long time and a good time.
We can go to the next slide. So progress that we've made so far. So one thing that was a huge issue is the registry. So in December of 2021, a bill came out, NJS 4229. And that was something that was not well received by doulas. In short, doulas felt very unheard and very disrespected by what was in the legislation. So what did we do about it? So we brought together a stakeholder group to discuss the impact of the legislation, how it would negatively impact doulas and their ability to be able to perform their work. And we brought the parties that needed to be heard to the table, as well as the parties that need to hear them. So a stakeholder group that consisted of DOH, as well as doulas in New Jersey and different representation. So making sure we created that space for everyone to have a seat at the table to be able to discuss their fears. So after that, we had a larger scale community convening where we kind of collected all the voices. And it was a very interesting session. I love that session. But after that, so we could really center the voices, we had a smaller session. So we facilitated focus groups around the legislation. So we identified what are the issues with the current legislation and how it's going to negatively impact doulas, and also work with individual doulas and doula organizations to brainstorm solutions. So what arose out of that, we consolidated legislation feedback and comments and communicated it to DOH. So essentially, we took the bill and kind of ripped it apart and said, this is actually what we want here. So we were happy that we were able to facilitate that conversation. New legislation has not come out yet, but those comments are where they need to be and are sitting with the right people. So we actually anxiously await what's going to come out of that. But we're happy that we were able to center the voices of doulas in New Jersey around this legislation, as it would directly affect them.
Thank you so much, Shanbe. So as far as support and engagement, we're looking at a few things here. Community is very important to us at DLC, and we want to highlight a few projects that are coming up. So Widespread Care is currently building a doula platform, and the idea is that it's going to be owned by doulas. So that it's going to be a system that has all the features that we need to be able to do our work. And that would also connect us with clients and resources and various things in the community. We have our inaugural DLC newsletter. I'm very happy about this. This is my baby. It's coming out this week. If you are not on our mailing list, we would love to have you on it so that you can be in the know. And then also a few events that are also coming up. So we've created lunch and learns, and we want them to be on a monthly basis. Doulas are jack of all trades. Like, we are just amazing, and we want to be able to tap into various resources in the community. So we're going to be having lunch and learns, just a monthly get together around lunchtime to be able to go through specific things like courses, topics, stuff you want to know, and just to gather together with community. The first one is about paid leave and how to access it for families that you might be supporting. Everyone's welcome to come. It's April 21st at 12 o'clock.
Sorry, I was just dropping something in the chat. So what have we done around Medicaid billing? So Medicaid billing is a huge and large thing to tackle. It's a huge animal in itself. So doulas being able to bill for Medicaid, this is a completely new system for anyone who hasn't billed before. So what we did is we sat down first with HealthConnect One and the Doula Network, who's our primary billing partner, and created focus groups with doulas to understand what are the complexities of the Medicaid process. So where are all the stops that you're meeting in just getting enrolled, just getting your Medicaid ID number and starting the process of contracting, as there are 5 different managed care organizations in New Jersey. It can be a bit of a hassle. So focusing on what area and problems are you having the most, and let's see if we can tackle those first. We've provided one-to-one support to doulas to help them with the Medicaid enrollment process in itself, and also the billing process. As we stated before, if you don't have background in billing, to suddenly become an independent contractor and have to bill yourself, it is a large undertaking. So we've been able to support and just have that one-to-one billing support. So we teach you, this is how you bill, these are the codes that you use, this is the system that you use, and this is how you submit the bill for people to be able to get paid. We've had initial meetings with the managed care organizations and are conducting ongoing meetings for future planning. So what we took from those conversations and those focus groups, so what are the issues that doulas who are currently enrolling or trying to enroll in Medicaid are having? Let's see if we can fix some of those issues. Let's bring it back to the managed care organizations and see what we can sit down at a table and what we can do to fix some of those things. Currently, we're forming a work group to streamline the credentialing process. That's been one of the larger hassles, just because credentialing has to be done first with getting a Medicaid ID number and then individually with 5 MCOs. So we're forming a work group and see where we can streamline that credentialing process for the Medicaid enrollment and also for the MCO enrollment and contracting as well.
So next steps in planning, what's happening next? We are so excited to announce this. We are planning a doula conference for July. It will be in Central New Jersey, just for ease of access for North and South Jersey folks. It will be free to New Jersey doulas. You'll also get to meet us in person. DLC and HealthConnect One staff members and team members will be there. We're planning for around 200 guests approximately. And it's just honestly a chance to, again, connect with the community, engage, network, a chance for doulas to meet potential mentors and just to get to know one another. We're hoping that in the morning it will be a learning segment just to be able to hear different guest speakers, see what's available for you as far as your afternoon sessions. And then we're hoping that once you eat, you learn a little bit, you'll sort of get to pick your own adventure in the afternoon. So there'll be various breakout sessions and some very, very exciting guest speakers that we can't announce yet. But once again, if you join our mailing list, you'll be able to get to see any upcoming events and stuff like that. So super excited for that part. And then also, we are launching the inaugural perinatal perinatal community health worker training from the Gaines grant. There are going to be 2 cohorts. Currently, cohort 1 is we're enrolling, and applications actually close tomorrow. We're actually almost at the 30 spot limit. So if you know anyone who wants to get their application in, it does close tomorrow. We will be confirming participants by April 18th. And then, like I said, there's 2 cohorts. One is for now, and then the next one will be in the fall, so in September. So this is pretty amazing because trainees will be eligible to become not only certified doulas, but also breastfeeding peer counselors upon completion of training and all practicum requirements. Trainees will also be able to receive stipends because we are aware that doing this work can take away from various parts of their lives. And then also we want them to be matched with doula mentors because in this work, it's crucial to be able to have not only a mentor, but again, we want to create longevity in this field. Specific curriculum highlights that we can share right now. There'll be an intimate partner violence trainer. CPR and first aid is available for also mental health first aid, various segments on Medicaid enrollment as well as billing. And that's our flyer. Kick it over to Shantae for Q&A.
Thank you. I do see a question in the chat. Joni, I will ask you, can you drop the link to everyone for registration for that training? Because I see someone in the chat says that they thought they missed the registration period.
Sure.
So I have a question from Hannah. You're in Oklahoma and you're in the early stages of planning doula reimbursement. What does collaboration with the Department of Health look like for training on reimbursement? Nasaji, I don't know if can we bring someone up so I can have them speak? Because I just need clarification on that question. And it might be easier if I just have her speak.
Hi, can you guys hear me?
Yep.
Yeah, so I was really just wondering what that looks like. You said that you do a lot of the training and one-on-one training of like what it looks like to be set up for Medicaid reimbursement. And I was just wondering, is that something that you guys do entirely on your own, or was that training created in conjunction with the Department of Health?
So it's a training that we formed on our own. So first we looked at what were the stopgaps in Medicaid reimbursement, and we found that really it was getting enrolled, just getting a Medicaid ID number, and then the fact that you had to enroll with 5 different MCOs. So training on what that enrollment entails, and then training on how to actually bill. So we have our partner is the Doula Network on this effort, and they actually are, billers. Like that's their primary background. I wish Elizabeth was here because she gets her spiel so much better than me. But primarily, we needed someone who had a billing background and could teach you like, this is what it looks like when you have to add a modifier or a code. So what we did is we went to the MCOs themselves to find out what they needed for their billing process. And then we created a separate training that, I guess the biggest thing would be to talk to the Department of Health, talk to Medicaid, and then talk to the actual MCOs themselves to see what is it that we need to communicate with doulas. A lot of the communication that goes out to doulas it goes out in a form that isn't necessarily easily understood by someone who has no medical background, billing background, anything like that. So it was really basically taking all of the information, combining it, and then translating into English terms, something that can be easily understood and streamlined.
Thank you.
Yeah, does that answer your question?
Yes, that is so helpful because our healthcare authority is really eager to move forward with the Medicaid reimbursement process. And myself and some others are trying to think through what this really means for doulas in our community, and what are the what are the other pieces that need to happen if that reimbursement is made available, because we know it's not going to be as simple as reimbursements available. Okay, now everyone's getting reimbursed.
So I think one thing that was started is there were doula pilots, and I can speak to this on and other work that we're doing with different MCOs who are doing this right now. One thing that helps is first creating like a focus group of doulas, just to see, where they are, their needs, because we want to create a program that makes sense. So it's something that they actually want to enroll in. I use my favorite phrase, if you've been on a meeting with me all the time, is Field of Dreams. We say if you build it, they will come, but if it's something that doesn't make sense to them, they're not going to come. So building something that makes sense and centering their voices, so creating a focus group. And then a pilot, like right now we're doing pilots in several states with MCOs, just so they could see what billing looks like for a doula, like what the visit structure looks like, how that's going to be formulated, what partner, if you're going to use a software platform to log these visits and then bill from there. So really like what that can look like. And, I can drop you my email. We can have a larger conversation because I don't want to take up too much of the meeting. But starting small first, seeing what arises from the pilot and then moving forward and expanding it. That's what we're doing for the MCO project currently right now, starting with small pilots in a target zip codes that have, highlighted pronounced disparities. And then after we get this set of doulas, maybe from a community doula organization that are set to bill and have done these visits, and we can have some data around, hey, this is what it looks like. This number of visits makes the most sense. These referral sources and referral pathways makes the most sense. And then moving forward from there, that would be my suggestion.
Thank you. This is so helpful. I would love to connect over email so we can talk about it, because I don't want to take up more time on your meeting either, because I know this is very New Jersey focused, but just wanted to learn more about it.
No problem. I don't see any other questions. Were there any other questions that we were missing?
There are any questions? Oh, wait, I see one. Let me see. I went to what counties will this cover? Was one question. There's a few, so I'll chunk them out for you. So the first question was, what counties will this cover?
I'm assuming you're talking about the training. The training is open to all of the counties. It's a New Jersey training and it's virtual. So there will be some in-person sessions like the CPR session and at least one other session that'll be in person. But we'll collaborate to try to make sure that we have those sessions like in a North, Central, and South location, but it's open to everyone because it's a virtual training. Okay.
And then do you need to be like currently certified as a doula?
For the training, no. To enroll in Medicaid, yes. There's a list, NJ DOH has a list of approved training. So if you've trained through a specific agency, if not, you can participate in the supplemental curriculum and then go ahead and move forward with getting your Medicaid ID number to be able to bill.
Is that list publicly available of what?
The approved trainings?
Yeah.
Mm-hmm.
Okay. And then their last question was, I'm assuming the answer is no, but is there an age limit for participation?
There is not an age limit, but I guess we would prefer if someone is at least 18, just because of the different things that they have to certify in. It makes it easier if they're of legal age.
Gotcha. All right, but there's no upper limit. Okay.
Not at all. We welcome all doulas, actually, in like I don't want to say older, like don't beat me up, but they make the best doulas because they got that big mama energy and all the experience. Absolutely. So we love that.
So I'm not seeing any other questions in the chat. Does anyone else have any questions or concerns of things that weren't addressed as of yet? There were a number of links dropped in the chat. So this whole product will be recorded and accessible. So you'll get an access to the link of all the chats that were in there if you forget something. And we can always follow up by email and include those things via email after follow-up. So I'm not seeing anything additional come in. So I'm going to assume all hearts and minds are clear. So I want to thank you both for your presentation. If there are additional questions, I will forward them to you after the fact, but thank you all so much for the introduction. It sounds like a very exciting program. We're excited to partner and connect in the future. So thank you. And with that, we will end our first policy day for the Black Policy Corner in New Jersey. We will follow up tomorrow with day 2, where we have a number of different sessions, including prevention of stillbirth. We have a session on bills that are currently active in New Jersey. And we will also be talking about specifically Medicaid with the postpartum expansion and how that works and how that'll affect Black infant and maternal health. So thank you all so much for attending our event. We hope to see you in attendance and engaged at other events throughout the rest of the week. Thank you so much and have a great rest of your day.
Thank you.
Thank you. Bye.